For Dr. Hartford, I learned she's a medical bias, and her job description is providing information, diagnosis, and medical treatment. The next guest speaker is Erin Boggs, and she is a nurse anesthetist. Her main job is pretty much to take care of those with anesthesia problems, and she monitors the anesthesia using like the monitor. Uh, the next speaker we have is Dr. Allen, and I didn't learn too much about the medical side, but I know he's a motivational speaker, and he really touched me because he taught me how I should focus my mind on school. And whenever something is important during school, I have to tell myself that I need to do it and put my like fun and friends aside because that is more important than that at a time. And he also, helped me get through what I want to do in life, and also like he helped me set my plans for college and the future because just the way he presented himself and the way he motivated me to really think about what I want to do. So like sometimes I want to hang out with friends and I have to study. Now I know that I have to cut it off. Now I know when not to do that and when to stop. So I really like Dr. Allen because his motivations his motivational speaking is really impacting me in a really positive way. Nicolette is a guest speaker that introduced me to healthy eating. Not only did I learn about carbs and fats and protein and what is best for my body, but I also learned one thing that really like I took out of that was that you can grow like people are learning how to grow um, like meat out of stem cells. Like they're learning how to grow animal foods out of stem cells, and they're trying to do that in the labs right now. It's not fully done, but they're trying to do that to reduce animal cruelty, to reduce like animal abuse and slaughtering of animals. And I really think that's really good for the environment because there's so many animals dying, especially now during this pandemic. There's so many animals dying, and it will be good for for animal lovers like myself, but that also loves meat. You know what I mean? Like it will be good for those people. That's one thing I really took out of that. So I really like that. This guest speaker talks about ultrasound, and I learned that ultrasounds are used or it's pretty much an X-ray used to detect a body's element and detect like whether it's a boy or a girl. And they use high frequency waves to see through the womb of a woman giving birth. Okay, this one right here, stop the bleeding training, was a whole different kind of experience. Like, but I learned how to prevent bleeding loss. Where if it's a big cut, you put a lot of tissue or a lot of like first aid kit, like all these kind of tissue or maybe fabric, and then pressure it down, and then call the ambulance immediately. And you have to pressure it down because if you don't pressure it down, the blood will just keep spilling out of the body, and it may cause through blood loss. I also learned that if it's too big, if it's too if the cut is too big, you use this clamp to clamp the other end of the of wherever of the body that's bleeding. You clamp the other end, and then you put like fabric around it and tie it tight to make sure like the blood won't be flowing out of that. Um, yeah, I learned that it's really tenseful because sometimes you may have to sit on the person to really prevent blood loss because the blood will just keep flowing out and out and out and out. And this is a really interesting experience because now I know what to do if I see somebody bleeding. If I see somebody like getting shot or something, I know exactly what to do. So I really like that experience. Yeah. So Dr. Awdish talked about in shock, and I love the book personally. It's a pretty good book. It's not a bad book. Um, but her when she was speaking about it, it really she really brought life into the book. Like she it taught me how what she went through while she was in a coma, while she was having problems, and what really infuriated me about the book was how the nurse told her to hold the baby. Like even knowing the baby was dead, the nurse still had the audacity to say like, "Hey, why don't you like hold the baby?" Like, I mean, I don't know, man. Like that kind of annoyed me. But other than that, her speaking about the book was really good. Like I learned a lot about what she was dealing with and um how hard it was as a patient to communicate with the doctor. Because that's your life on your hand on the doctor's hands. And if you don't communicate to the doctor and tell the nurse what you need, sometimes the doctor won't even follow that. But if you don't tell the nurse what you need, then that's life on their hands. And man, this book made me like this book opened my eyes into a whole different type of experience in a hospital. So it's a really good book, and Dr. Ardish spoke on it very, very well. Um, this dentist guest speaker, I just learned about there's different types of dentists. Like there's the general dentist that just checks on your teeth, checks if you're doing what you're supposed to be doing, brushing and flossing, and cleans your teeth too. And then there's an orthodontist that takes care of like your teeth being straight. Like they do braces, they do other kinds of stuff to make your teeth straight and healthy and stable. So yeah. Okay, I'm not gonna lie. The OG or the gin experience. The first time I saw it, I thought I was not gonna like it, but at the end of the day, I realized what pregnant women had to go through, and oh my goodness, it is crazy. Like, not only did I learn like how a woman delivers a baby and everything, but what they had to go through. Like, I put that big like pillow fabric thing on my belly, and I try to like bend down and stuff. I was like, man, this is hard. Like, wow. Like, man. And I also learned that when the woman delivers the baby, they usually put the baby on their chest as if like, it's a real blessing, like they love the baby. I also learned in this one person told me that some people eat the like this fast food thing that after they deliver the baby, some people eat it or some people like bury it for religion. And I didn't know that, but that's crazy to me. But mostly they throw it away. But other than that, it's a really cool experience. I actually learned how it's like to be pregnant. It's a pretty interesting experience. And yeah, it's I really love those guest speakers. They really did well. Like more than just speaking, they actually showed me um what it's like, and also they also showed how it's like to be in the situation. Like I remember when Ahmed was like pretending to be like the husband of the person delivering the baby, and it's like really tenseful because like the wife is in pain and like it's a big moment for her. So it's like but yeah, I really like that experience. So Haven is a company that deals with relationship abuse, and man, I realize how really serious it is because there's a lot that goes on with the relationship abuse, like manipulation. They feel sometimes the woman or the man they feel threatened that they can't speak up. Because I always thought like if you're getting abused, why can't you just speak up? But I realized after that, like people they sometimes can't speak up because they're either threatened or. So and what I learned from that is to go to a safe place and or go somewhere that they won't know to speak about it, to speak about whatever you're going through, whatever and hide it from them. Because if you show them that, then they're going to do something to like not let that word out. They're going to take your phone. They're going to block the internet. And it's really really serious. Not only relationship abuse could be physical, but it could really be emotional and mental. So I really learned a lot about that, and it's an interesting experience. For the biotechnology sales representations, I learned that they sell various products manufactured by biotechnology and pharmaceutical companies, and they also help to market it to the medical field area. Um, what's required is like a 4-year degree and knowledge on the products that they're selling to, obviously. So this is for the post-op surgical nurse, and I learned that she was originally a regular nurse, which pretty much just tells the doctor what's going on with the patients and everything. But now she's moved to where the corona patients are, and I believe I'm pretty sure she like does the same thing, but now it's more like she's more involved into the patients. Like anything patients need, she's always on top of it, and she's pretty much like the patient's eyes and ears for the to the doctors. Like whatever the patient needs or whatever the patient is going through, she always notifies the doctor so the doctor can come by and do its job. And the Bleeding Edge documentary was a pretty interesting documentary. The documentary was about this medical device called Ensure, Ensure, I don't remember. I'm pretty sure it's Ensure, but it's pretty much a device that is like a birth control device. It's pretty much a device that helps to prevent pregnancy, and it was going well for a few like months, but and it's supposed to go up the vagina into the fallopian tube, but it was going pretty well for a few months, but they started having some problems in their bodies, like throwing up and headaches and fever, and some people can't even walk. Like it was really bad, and it got bad to the point where the company was being sued. Like it was crazy. Even when the interviewer was asking the company what happened, why did you think this was a good idea? Did you even test it out? They didn't even say anything because they knew like they messed up. I mean, that's what I assumed. I assumed that they messed up. But it was a pretty interesting documentary. What I took out of that documentary was to make sure you fully test out the product before you know it's ready. Like you really got to do that because I want to I kind of want to do this genetic engineering type of thing, and like my project was big, but after I saw the documentary, I'm starting to think twice about that because I don't want to be in that situation where something mess up and I'm being sued for it because now the company is pretty much like sued and done for. But that's a really interesting documentary, Um, but yeah, I like it. I rate that. It's a pretty good documentary. HOSA based projects. So, um, one of my favorite projects was when Tyler, me, and Hassan, and oh yeah, and Luke, we did this project where we talked about kidney stones. That's a pretty cool project because not only do we just talk about it, I liked how we like created it too. Um, that's a really interesting. I really like that project because I learned more about kidney stones. And another project that I really like is the inventing project where we learn we invented this blood pressure tracker thing. This blood pressure tracker where you get doses of medicines based on like your you know issues, and it tracks how much you're taking. I really like that project. Um, yeah, it's a pretty fun project. Not just because I get to interact with people, but because we get to do a little brainstorming and we get to have pros and cons, and we actually know how it's like to be an inventor, and it's really nice. Um, yeah, In short, overall was a good book. I like the book. Um, at first it was boring. I'm not gonna lie to you. At first, the few chapters, it was kind of boring for me. But then later on, I was like, wow, she really went through that. She actually know what was going on when people thought she was in a coma. Man, like it was an interesting book. You know what I mean? But I mean, like, what was really interesting about it was when she got out of the hospital and she looked at herself and she's like, man, I was disgusting. Like, she looked at herself and she just didn't recognize herself. Um, she could have barely walk. She could barely put on her sock. Like, it was using so much muscle. And yeah, that's what I like about the book. And what I also love about the book at that time was the group discussions. I love the group discussions because I'm open to hear other people's opinions. I'm always interested in other people's opinions and their outtake and their input about it. And just hearing their opinions makes me see a whole different perspective on the book, and not just on the book, but in like the medical life in general. The patients in general. Now, because the doctors, I mean, that book made me believe that the doctors really just care about, like, boom, they just want to get things done right away. Like, they're not really, I wouldn't say all of them, but some of them are not really there for emotional support. And I'm noticing that with Inshock because, she's dealt with a lot, and the doctors weren't there to actually help her with emotional support, except for the nurses, of course. But yeah, other than that, I really like it. I love the group discussions because of their opinions and their input. And yeah, it's a really, really good book. I highly recommend it to anybody who's gonna read it, who wants to learn more about the medical field. One of my favorite things in this class was working with my friends. Not just my friends, but with other people. Brainstorming, doing projects with other people. I like that. It's interesting, and it's just fun. It's fun to interact with other people and work with other people too. I really like that. Um, I also love the guest speakers. The guest speakers was one of the best things that ever. Like, oh my goodness, I actually really loved it. Like, man, I learned so much about the medical field. Like, I thought the medical field was so direct, like so straightforward, but it is like it's very broad. But when you expand through it, when you look into it, it's like different varieties and different ideas. It's like a whole, like, new type of invention. Like, I really like that. I just love that. That's one of the things I love about that. Um, what else? Yeah, that's all I could think about for the peak at the moment. But yeah, man, I love working with my friends, and I love the group discussions. Oh yeah, that's another thing. I love the group discussions, working with my friends, and the guest speakers. The guest speakers, man, just amazing. The pit of the class, I guess that would be the least favorite part of the class. I guess I would say the projects, but I mean, don't get me wrong. I love the projects that you guys provided for us, but I mean, to actually do it is like it's like a lot of work, and it's pretty long. Like, I mean, I guess that's just the least favorite part of the class. But I love projects too. I mean, I'm just trying to find something that I don't really care much about. A general improvement I highly recommend you guys to do is the guest speakers. Um, I love the guest speakers, and it really helped me. So I think if you keep putting them there, it's gonna help people in the future and learn. One thing about the guest speakers, though, I would highly recommend you get those guest speakers that doesn't just talk. I love the guest speakers that also, like, shows the hands-on and, like, the actual, like, what's going on, because I learned more about that instead of them just talking. Like, when they're talking, it's just like me watching a YouTube video. I still learn it, but I'm not really feeling it. Unlike the bleeding experiment or the pregnancy experiment, those kind of stuff, I'm actually learning what is going on, and I really like that. And I think you should improve on getting those type of guest speakers. The other guest speakers are good too, but that's just personally how I feel about it. I would love if you guys explore more on the medical field with the salary, because I feel like money is also important. And on top of that, the daily life of whatever the medical profession is. If you're a dentist, I want to know how the daily life of that is. If you're a surgeon, I want to know how the daily life of that is. If you're a biotechnologist, I want to know how the daily life of that is. Stuff like that, because people can talk about the job description and everything. That's cool. But I also really want to know how it's like working hours, interactions, how hard it is, stuff like that. Because it's good to inform what people are gonna go through and what people should expect when they join a certain medical area. One thing I'll take away from this class is don't judge a book by its cover. Before I walked into class, I thought medical skills was just going to talk about just doctor, but I learned that it's more than that. We talk more about like the projects. We learn more about different medical fields and different varieties. And yeah, that's one thing I really would take in the class. One word I would describe from this class is magnificent.